In our active lifestyles today, people usually sooner or later are going to have some sort of minor injury, strains, pushes, pulls, things like this. And remembering the acronym R.I.C.E can help you in helping to treat others or in teaching people how to treat themselves for minor injuries. And we want to emphasize the minor here. So for minor sports-related injuries, active lifestyle-related injuries, you should know and be able to teach others the acronym R.I.C.E to help them deal with these minor hiccups. So we'll start with the R, and that is rest. Obviously, if someone has injured a joint, a muscle, some part of their body, lessened activity and less weight bearing on that particular injured part is going to help a great deal. So you want to get them to rest. Now, I've known people in the past who somehow counterintuitively thought the opposite. They receive an injury and they think, you know what I really need to do is I need to work it out. So I'm going to take the injured joint or muscle and I'm going to work it harder, and that will make it get better. It only makes it worse. So if you get a knee injury from playing tennis, don't say I'm not going to run 5 miles home. Get your weight off of it, limit your activity. That speeds the healing. So the R is rest. The I stands for ice. Usually immediately after the injury for acute pain, ice can be very beneficial. It helps reduce inflammation, it helps numb pain, and is helpful. Now you need to make sure that you only do it in 20-minute intervals. So ice for 20 minutes, then remove that. You don't want to cause tissue damage from freezing or from the cold. So ice within the first 72 hours of the injury in 20-minute intervals as necessary for pain and inflammation. Rest, ice, and then C tells us compression. Here we're thinking of ACE bandage wraps, air casts, things like this. Compression helps provide support to the injured area, especially if it's a joint. It also lessens inflammation. So resting, less activity, get the weight off of the injured area if possible. Ice to help limit pain and also inflammation, only in 20-minute intervals. And then compression, wrapping the area so that there's more support and there's lessened inflammation as well. And then finally, with the E, we need to think here of elevation. Here, if the part that's been injured, especially if it's in a lower extremity, get it elevated. Once again, it takes the weight off, the pressure off. You've applied ice, perhaps compression, but the elevation helps as well by keeping blood from flowing there as rapidly and keeps the swelling down. So for minor sports-related or active lifestyle injuries, remember R.I.C.E. Rest, ice, compression, elevation. Some people like to add one more letter to this, and they put the D in front of it. D stands for drugs. And here we're not thinking illegal substances. We're thinking of your basic non-steroidal anti-inflammatories and analgesics. Ibuprofen and Tylenol, aspirin basically. So along with rest, ice, compression, elevation, it's appropriate to take, as the prescribed on the bottle there, your basic non-steroidal anti-inflammatories and analgesics, aspirin and ibuprofen. These things can help with the pain and also shrink swelling. So remember R.I.C.E. or D-R.I.C.E., but basically you're wanting to help people know better, you know better to how to help them, and also help them know how to help themselves for minor sports-related injuries or active lifestyle injuries. If you'd like to learn more about this and things related to it, there's a link underneath this video. Click on it. It'll take you to a website with that information. And also while you're there, you'll find a link to an ebook that's ready for immediate download.